So I talked about the value of a community pharmacist. The other thing that I should probably expand upon is this notion of how does a pharmacy make money? How do pharmacists make money? So you could argue for a past century, you had apothecaries, druggists, chemists, and then pharmacists pop up in the 1970s. They are a very much a product based model. That's by and large how most pharmacy businesses function in the United States. And what I mean by that is how fast can you verify and get a medication dispensed to a patient? I would say that's why you've seen a lot of disruptors trying to go in, either trying to find new ways to do that whole product-based model, whether it's repacking a drug and mailing it to a patient, delivering as fast as possible, offering novel, more interpersonal pharmacy experiences, which just kind of falls back on how to get more drugs to patients. So it's very much a volume-based business, in which case then you're suspect to reimbursement fees, which PBMs could be very annoying for you at that point. And you're kind of like at that point where you are very much like, how do I get the most drugs out to patients? How do I deliver them fast enough? This is why you're seeing things like people talking about drone technology and such. So you're playing with the pharmacy or the drug supply chain, with pharmacists being towards the tail end, getting directly to a patient. And I would say in terms of innovating that space, there's still a lot you could do, but it's probably doesn't sound very sexy, but a lot of people seem very interested because, again, coming back to what I said in the very beginning, most people don't know what we do, and they assume the pharmacists just basically dispense medications. That's where they want to do the innovation because that's their experience with pharmacists. Now, there is another side. There is a service-based model or a clinical-based model, depending how you want to come at. And what it is there's something called medication therapy management or comprehensive medication management services. Some offshoots of it might be like seeing having pharmacists being able to give vaccinations. Pharmacists are expanding to prescribe medications like oral birth control, tobacco cessation, things like that are coming down the pipeline. You're seeing expanding across the states, but you can also have pharmacists through different insurances basically bill for reviewing medications. This is more or less a service that can be done. You may see employer-based programs do it. Some payers will cover it, and most of the time it's targeted towards a lot of Medicare patients. They have to have multiple comorbidities, and it's kind of cool. Does it make bank? Oftentimes not, because it is a time-consuming process for the amount of money you get back to it. That's why I find some very interesting companies that are trying to offer like data analytics or even augmented intelligence to speed up this process, make it kind of more of a reality. So there are ways for pharmacists to bill for a lot of different clinical services. One group, if you want to look into it, would be the American Society of Consultant Pharmacists or a consultant pharmacist, independent pharmacies, and some outpatient clinical pharmacists. You'll find that these people tend to be more knowledgeable in terms of like, how do I make a whole business out of talking to a patient, reviewing their medications, reviewing their past medical history, looking at their labs, and optimizing their medications. Because we have tons of literature, we have tons of data saying that for every dollar you spend for this MTM services, that you prevent money downstream from being lost. So we've shown that pharmacists can reduce hospitalizations and readmissions, that we can lower A1C for diabetes, that we can improve blood pressure. There are pharmacists that can establish collaborative practice agreements with physicians and prescribe. You have California that's advancing the advanced pharmacy practice model, where pharmacists can order labs and prescribe certain medications. This tends to probably is where things are going, but we don't have a federal provider recognition at this time, so it's a state-by-state issue. And that's probably one area that's a huge limitation for this profession. So one thing I want you to consider is that if you or a company is trying to figure out what clinical services to get into for a pharmacist to do, look for those types of pharmacists as your connections that you want to make, because they can probably do a better walkthrough for you, especially that experience, that can lead you and be like, okay, so if I want to expand a service I could offer to a pharmacy that could allow pharmacists to do X, Y, Z and make money off of it, you should probably rope in one of those pharmacists to help you actually understand the process. And again, the workflow, what to bill for, what are limitations, and how to basically sell it. So those are big things I would say is something you should consider. And that's going to be what I'm going to call for here between those two different models. So product-based model, a lot of people are going for that. And then there's this whole clinical service-based model that I would say is really untapped. I mean, there are so many issues in pharmacy where we could do better services that we can't because we don't have the tools or resources there, and they could still be developed. Um, and I'm going to add on here. So there's a big thing I've been trying to tackle is medication adherence. If you're a medication adherence startup and you don't have a pharmacist or anyone clinical on staff to help you out, you should probably do that. I've seen a lot of people pitch a device that they think in theory would help out with adherence, but would not make sense on a practical side to develop or basically to create or to fill, and you wouldn't really get any good gravitas with it. So definitely if you're in that space where you think about medication adherence or like packaging or like those kind of services, definitely look towards like a community pharmacist or someone else in like maybe packaging, long-term care, or automation that could help you with this, because I think you're going to need it from a design aspect and also from a workflow integration to make it viable, because you may kind of something that looks very awesome, and then you'll hit this point where after if you get enough investment where you're saying now we want to scale this up, and you find that to fill the damn machine with medications doesn't work, because there's basically no one that could really work, and then you have to have pharmacists fill it by hand, bit by bit by bit. Remember what I said, if you're going to go for a product-based model, you need to have high scalability and get the drugs out faster. And that kind of could be a limitation factor for you. So we're going to end this section here and move on to the next one.